Welcome back and thanks for staying with the agenda. Now, the LGBTI community is often reluctant to seek medical care or are denied access by healthcare providers due to discrimination and or lack of knowledge or experience with LGBTI health matters. This discrimination and stigma results in increased HIV and TB transmission because patients do not adhere to their treatment routines. For more on this, we're joined by Getty Myeni from Beyond Zero District Activity. She's the coordinator. Getty, a very good morning and thank you so much for joining us.
Good morning to you, Desiree, and your listeners.
What are the challenges the LGBTI community faces when seeking health care?
The challenges that they are facing is discrimination and people not understanding how to treat the LGBTI community.
How does this discrimination manifest?
You see, it happens mostly in health facilities and in police stations because those facilities are the ones that are mostly meeting LGBTI community because all South Africans need health services. So as a South African LGBTI member, if you go to a clinic, that's where you find that you are being mocked and things are said behind your back when they see your ID number or when you appear to them dressed as a woman, but on your ID number you appear as a man. So those are the discrimination that we face the most.
I don't know if you know the coordinator of the Feather Awards, Tammy Dish, recently with partners opened a facility in Melville for this specific purpose to look into the provision of health care for people in the LGBTI community. Is there a need for more of such centers? I don't know if you know about it.
Yes, I know about it. There's a lot of need for it because I don't think the government has put measures on with the COVID-19 on facilities on quarantine facilities that they have created. Because if now, maybe let's say for instance, a transgender contracts COVID-19, how will they treat the transgender that will be admitted? Because they haven't said, I haven't seen anything that talks about what will they be giving transgender people on their facilities, because what I always see is they talk about heterosexuals, they talk about males and females. So I want to understand, I want them to open more facilities so that whenever one transgender contracts COVID-19, it will be easy for that transgender to get a space in that facility, and also that the nurses that are there are sensitized how to treat transgender people or LGBTI member in a round-off.
How do you rank these issues when you separate them in terms of physical or biological issues or psychological issues or just issues of infrastructure not being in place for this community?
You know, when it comes to infrastructure, it's where it's most distressing because in hospitals, maybe sometimes they would put you in a male's ward, whereas you would feel more comfortable in a female's ward because that's where you belong. That's the group of people you want to be with. So in hospital, because they see an ID number that says male, so they will just push you to a male ward where you won't feel comfortable, where you will just deteriorate more and more if you are sick because they haven't given you the platform to feel comfortable in that space.
Just tell us how something like that would affect you. For instance, you classify as a woman. How do you negotiate? How do you how do you walk this path of trying to convince people, especially people who provide essential services to you, in terms of how to identify you and how to recognize you?
So from my side, I always tell them to ask me before what would they like to call me, because it's very bad to assume, because if you assume, you'll keep on making more mistakes. So if you ask, then I'll tell you that I prefer you to call me as Miss or Getty. So if you say something else, Mr. or something else, that will make me uncomfortable, and that will make me not want to come back to receive the service that I need to be rendered with. So most of the time, people, they don't ask, they just assume. And I think the government needs to make more awareness of LGBTI communities, so that our community and the government itself can understand the dynamics of LGBTI community. And more, we need the government to be inclusive of the LGBTI community, because it means a lot to the LGBTI if they will be recognized and they'll feel more comfortable in sharing their stories with the community. And more, I'm very much happy with what Beyond Zero and IHPS is doing. They are showing us that we have taken a step going forward, so that people can understand and start learning more about LGBTI issues, instead of people assuming and making unnecessary statements, because you find people that don't know what they're talking about, but they say it.
Okay.
So with Beyond Zero and IHPS, it
Getty,
gives us an idea that people are starting to understand.
Getty, we have time constraints, but just to finally, what do you expect the president to say, or if you were to advise the president in terms of his announcement tonight, what would you want him to say to the LGBTI community?
I would like the president to just tell us that they recognize us and they want us to feel comfortable, as it is on the South African constitution, because the more they tell us that, it's the more that the community wants to listen and understand what the community, what the LGBTI community is facing.
Thank you so much for talking to us this morning.
Thank you, Desiree.
Getty Myeni there for you. You're watching the agenda.